Hello, I'm Richard Turkington, the Director of Housing Vision, and I'd like to introduce our Older Persons Care and Prevention Services Toolkit. The growth in the older population and the associated need for care and support are two of the major challenges facing our society. If we are to make best use of limited resources, preventive services are an absolute priority. Developed with Mark Goldup at HGO, this new and fully interactive toolkit enables you to determine the needs of older people and the care and prevention services appropriate to meet them. Already in use by social care commissioners and for strategic needs assessment, the toolkit enables you to manipulate complex data sets and deliver powerful intelligence that can really support your decision making. Based on very extensive research, it applies innovative modelling of the relationship between need and service provision. It's been fully and successfully tested in practice by unitary authorities in both rural and urban settings. With key source data already embedded, the toolkit has a wide range of modelling functions, including the ability to identify the numbers of older people and households with different levels of need, assess the impact on levels of need of long-term trends in the health of the older population, either stable, improving or declining health, determine the units of housing and support required to provide services appropriate to each level of need, compare estimated against actual provision both now and over the next 20 years, estimate the cost of providing such services, and finally, assess the potential of homeowners to release equity and downsize to more suitable housing. Whatever you are modelling, the toolkit enables you to test different what-if scenarios, with instant results at the click of a button. And what's more, you can revisit these scenarios at any time to keep your plans up to date. Results are presented in tabular and graphical formats that are easy to read, easy to analyse, and easy to present. So let's look at the toolkit in action. There are 3 simple steps. The toolkit is populated with embedded data for your local area. Using the 65+ population for any period over the next 20 years, the number of older households, the levels of need, and the extent of self-funding and informal care are all calculated automatically, then adjusted to take account of local conditions such as income, disability, and mortality. Whilst embedded, you can change all these data to suit local geographies and conditions. You've got complete flexibility. Moving on to services, you can see immediately the units of service required and the estimated cost, and model the impact of different health trajectories, levels of self-funding, and informal care. The local situation can be modelled more closely by entering the current cost to supply each unit of service, the number of units of service currently supplied or budgeted for, and any estimated increases in service costs over any period of time over the next 20 years. To estimate levels of under-occupation and the potential to downsize, options which can improve housing conditions or release equity, a further series of data is already embedded, but can be changed by you to reflect local conditions. That's it. 3 simple steps, and you can model and manipulate complex data on any spatial scale and keep your assessment live and up to date. Of course, where the toolkit can really help to make a difference is through the ability to identify current or projected shortfalls and surpluses, enabling you to achieve a closer match between requirements and service delivery, and make best use of scarce resources. When conditions change or policy shifts are being considered, the toolkit is a no-cost way of testing future options. Hopefully, this will have given you a brief glimpse into how the toolkit can help you and your team to access the intelligence you need, without the need for expensive surveys or research. You can find more information about each toolkit, including short introductory videos, via the links now showing on screen. Thank you for watching, and please don't hesitate to call or email for further details on any of our products or services. Contact details are on the screen now.